Hi, everyone. If you're just joining us, welcome. We will get started in just another moment. We still have some folks trickling in. Participant number is rising. So just hang tight and we'll get started in a moment. Today we'll be presenting on storytelling for policy change on HIV and aging. So that's what you're here for. You're in the right place. We'll get started in just another minute. Thanks for your patience. Alrighty. Some folks are still trickling in, but let's get this rolling just so we can get through all the great content that our presenters have ready for you all today. Before we get started, going to go over some housekeeping. First of all, my name is Cam Cody. I use he, him pronouns, and I am the Civic Engagement Coordinator here at SAGE. As you may know, this webinar is being led by SAGE today with some special guests. And let's see here. Just a couple housekeeping notes. The chat is disabled, but we do have the Q&A function available. So if you have any questions or comments, please feel free to use the Q&A function, and we'll get to those questions as soon as we can. We'll also have some time allocated at the end of the presentation to answer any questions that remain unanswered. I just want to note that this webinar is being recorded, so please avoid sharing any personal or sensitive information in that Q&A that you wouldn't want shared publicly. And finally, closed captions are available. You can find them just by going to that the bottom bar on your screen. If it doesn't show up automatically, there's a circle with a little ellipses in it. It says more. You can click that and should be able to access closed captions from there. All right. So again, welcome to Storytelling for Policy Change on HIV and Aging. We're very excited to have you all joining us today. So first, why are we here? What's the goal of the day? We set up this training because we wanted to help people aging with HIV and the folks that support them to craft compelling narratives and stories and very clear and specific policy asks to influence elected officials and drive policy change. If you're attending this webinar, you probably know now is a challenging time for the community and an important time to advocate and utilize personal experience to drive that policy change. As I mentioned, SAGE is sponsoring this webinar today. We also have a wonderful guest joining us. And if you don't know about SAGE, we're the world's largest and the oldest organization dedicated to improving the lives of LGBTQ plus elders and older people living with HIV. We do that through direct service at multiple centers throughout New York City, as well as our advocacy work on both the federal and the state levels. Founded in 1978 and headquartered in New York, as I mentioned, we are indeed national and offer both services, resources, and advocacy. You can learn more by checking out our website. And I will now pass it over to Ronald Johnson to get us started.
Thanks, Cam. And I also welcome and I'm glad to see so many of you joining us on this webinar today. And we want to talk about storytelling and your personal stories, but it's very important that our stories are personal, but they are well grounded in the facts about HIV aging and the reality, the factual reality of older adults living with HIV and what it means to be living with HIV and aging. Next slide. The first fundamental, and is something that I think all of you are aware of, the number of older people living with HIV is increasing. And that's the absolute number of people 50 years and older who are living with HIV, and the percentage that we who are older and living and aging with HIV represent in terms of the total population of people living with HIV. So the absolute number and the percentage of people living with HIV who are older is increasing. Next slide. I'm going to start by giving a pop quiz, and this is going to be a thought quiz. So you just think and hold your answer. According to CDC surveillance data, in 2022, people living with HIV who are aged 50 years and older accounted for how much of the total number of people 13 years and older living with HIV in the US? A, fewer than 20%, B, 40%, C, just over 50%, D, 75%. Now, just take a moment to think of your answer. Next slide. And in 2022, according to the latest CDC data that's available, persons 50 years and older accounted for 54% of all people living with HIV in the United States. So those of you who thought of answer C on the pop quiz, you are right. And 27% of all people living with HIV in the US were 60 years and older. And as the population grows, the gradations, we have people in their 50s, 60s, 70s, and 80s. And so we're getting a much varied population of people over 50 who are living with HIV. Next slide. And in 2022, again, according to the latest CDC data that's available, people 50 years and older accounted for just over 15% of all newly reported HIV diagnoses among persons 13 years and older. And what is very important to highlight, and I think this is a critical point, in 2022, of those people who were diagnosed, 33% of people aged 55 years and older, when they received their diagnosis, they were already in late stage HIV, formerly known as or currently known as AIDS. They received a diagnosis later in the course of their disease. And I think this is something we really very much need to highlight, that when newly diagnosed people 55 years and older receive their diagnosis, they're already well progressed into HIV and AIDS. Next slide. To meet those challenges of that older adults living with HIV are facing, the Ryan White AIDS program, which is the largest federal discretionary source of funding for HIV care, obviously is serving older adults, and older adults are representing a growing and significant portion of Ryan White clients. According to the 2021 client report, just about 48% of all Ryan White clients were 50 years and older. Of them, just about 60% live at or below 100% of the federal poverty level. 3.6% experience unstable housing, and 93 0.1% are virally suppressed. This certainly is good news. And in terms of older adults who are clients of the Ryan White program, that 93% is slightly higher than the overall viral suppression among Ryan White clients, which is about 88%. So slightly more proportion of older adults in the Ryan White program are virally suppressed. Next slide. I want to highlight some of the challenges that those of us who are older and living with HIV, and myself, I am an older adult living with HIV. The major challenges, one, the difficulties that we experience, many of us experience in terms of accessing and managing comprehensive and integrated healthcare. Healthcare that takes into account our HIV diagnosis and our aging and the health conditions that correspond with aging. There's a need for mental health programs and substance use and alcohol use treatment programs that are geared and tailored for older adults. The need for housing, food and nutrition, employment, and other socioeconomic support services. These are extra challenges for older adults living with HIV. The need for long-term care, and as older adults age and the management of comorbidities becomes more complex, long-term care becomes a very, very critical issue. There are need for programs that address loneliness and social isolation. Again, a major challenge that older adults living with HIV experience. And of course, the need to dismantle stigma and discrimination. And that includes ageism, as well as racism, transphobia, homophobia. All of the issues of social injustice are also manifested and experienced by those of us who are older adults living with HIV. So again, these are some of the challenges that older adults face and the reality that older adults are a growing proportion of people living with HIV. HIV and aging has become the norm of the face of this epidemic here in the United States. And it's really encouraging that so many of us are here on this webinar to dealing with this issue. And with that, I'll turn it to Aaron.
All right, sorry for the delay. My Zoom has been pretty slow lately. So let's talk about what it's like to advocate. So getting ready to advocate and what to expect in the room. And by room, we mean meeting with staffers or actual members of Congress or your policymakers themselves. So next slide. One thing that's not on the slide, but I think that's really important to know, is that some people are disappointed if they're not meeting with the member of Congress or the legislator themselves. But in fact, you can have a more impactful meeting if you're meeting with a staffer, because sometimes those members of Congress are kind of like figureheads, and it's really their staff that do a lot of the work. So if you can get to know their staff and they can get to know your story, again, that can maybe even have a bigger impact than meeting with the member themselves. So keep that in mind and don't be disappointed if you're, quote unquote, just meeting with a staffer. So what do you want to think about? What do you want to do during the meeting? First of all, introduce yourself. So say your name, mention that you're a constituent. That's really important because at the end of the day, they just care about getting reelected, most of them. So if you're a constituent, you really want to emphasize that. And if you're there with an organization, share that too. It's not, if you're not, that's fine. But if you're there with a group, like on a lobby day or something, be sure to share that. And include any ties you have to the community. So maybe even if you're not a constituent, maybe you grew up there, or maybe you have family or friends who live there, or you work for a company that's based there, who knows? But if you have a tie to the community, that's something that's important to emphasize. You then want to introduce the issue. So why are you there in the first place? So raise the topic you're there to discuss. So, for example, maybe you care about Medicaid, so you might talk about why or how Medicaid cuts will impact people aging with HIV. And then share your story. And this is really the most important part. And we're going to spend a lot of time on this today. Convey how your unique experiences have been and will continue to be affected by the topic at hand. So this is where you want to say something that'll really catch their attention and grip them in some way. And I think people think they have to have some kind of like big momentous story, but in fact, it could be just a small anecdote that can really make a big impact on people. And then finally, here we talk about making the ask. Ask for your elected official to support or oppose the issue, the policy, or the legislation that you've discussed, acknowledging that they might not feel ready to commit to a position, but you can ask that they consider it and take a position at the end of the day. I'd say it's quite common, especially if you're meeting with staffers. They'll say, let me write this down and I'll bring it to my boss and we'll see what they have to say. So again, I wouldn't be disappointed by that. That's typically what a lot of them say, unless they've already, very clearly taken a position on the issue. So for example, say you went in to talk about um, having Medicaid, help people on HIV, and maybe the members already said something about it. They might say, "Yeah, we're with you. We're fighting for that." But if not, they very well will say, "Let me bring that back to my boss." And again, that's not a bad thing. That's just kind of like par for the course with these meetings. All right, next slide. All right, pop quiz. When you're meeting with an elected official or their staff, and you want to stay in time in your meeting, what is the best approach? A, use the stopwatch feature on your phone or watch to ensure that you speak only for your allotted time. B, trust your internal clock, which is so accurate that Apple and Google sync their time to you. And you just have a feeling of how fast time is moving. C, keep talking until someone cuts you off. And D, don't even worry about the time. What you have to say is clearly more important than everyone else's input. And I can assure you, if any of you have been in a meeting on Capitol Hill or elsewhere, you've probably met people like this who say, "Oh, I know, I can, stay on time. I don't need to look at my watch." Or they just keep on blabbing until someone finally cuts them off, and it's really awkward because you're all sitting around the table. Or they just keep on talking and talking and talking and just don't pay attention. So, you know, I always, if I know I have a limited amount of time, say there's like 8 people in the meeting and you have 15 minutes to meet with the staffer, so maybe each person gets a minute and a half. I put the stopwatch on my phone, I put it right in front of me, and I give myself a minute and a half and I cut myself off at the end of that time because I want to ensure that everyone at that meeting has a chance to speak. And I think really that's the only way to do it at the end of the day is to like look at a clock, stay on time, and make sure everyone around that table is doing the very same thing. So the correct answer is A. All right, next slide. All right, it's a little bit more about stories. They should be personal. Incorporate talking points, but focus on sharing what you know and what your experience has been. I think if you start, talking about, all the ins and outs of Medicaid or Medicare and all this wonky stuff, the staffer might know that already, or they can look that up online. You're not really helping them at the end of the day, unless you're there to be a policy expert, but you're not. You're there to share your story and, tug on some heartstrings and move hearts and minds. So, make it personal, make it approachable. Use shared values to build bridges between yourself and the lawmaker. So maybe it's about family caregiving and the importance of family. Maybe it's about hard work. Whatever the case may be, talk about values that are important to you. And, even if they, might come to a different conclusion, they might have shared values and that might help them, move them a little bit. And as I just alluded to in the past, the most recent slide, keep it short. Pare your story down to its most impactful parts. And I'm thinking of some stories I could share that are probably 1 or 2 sentences that could be really impactful. It doesn't have to be a whole book. All right, next slide. All right, choosing your personal story. Pick a moment that gives a glimpse into your experience as a person aging with HIV or an ally. So stories it could be about living or being affected by HIV, growing older as someone living with HIV, examples of services that are needed, fear of HIV services going away. There's so many iterations of this. And again, it doesn't have to be this like big momentous story. There's big momentous event. Even a small little anecdote can be really impactful. All right, next slide. All right, I'm going to hand it over to Terry. I'll be back later.
Thanks, Aaron. So now we're really going to talk about all the components of how to build your story and to make your ask, which is really important when we're meeting with elected officials, whether it's at the federal level or at the state or city level. So what we're talking about today can apply to, any elected official or, quite frankly, a government official if you were trying to get them to change a policy in your particular state or city or county. Next slide, please. So let's talk about our story structure. And you'll see on the far right-hand side that there's the specific components that I'm going to go through. So for this slide, I'm going to talk specifically about what we call support in the story structure. And so calling this particular part support really emphasizes the importance of grounding your story in something that the audience can trust. And so it could include data, which is why Ronald, kind of went over a lot of the data and the facts at the beginning of our training. It could be about your background or context. It really should show kind of out the gate why the story matters or is worth telling. And it really helps the audience, and the audience is, the elected official or the staffer. It helps them kind of feel safe in like the context of the story, that is informed, and that they can really engage in kind of understanding why you're here today, before you get into, some of the emotions or the personal anecdotes that enter the picture. So I'll just use myself as an example here. So if I was meeting with somebody, I would say, hi, my name's Terry Wilder. I live in Minneapolis, Minnesota, which I've called home for about 3 years. And I live here with in my case, I would have to say cat, but you can say your kids or your spouse or your partner. Um, I'm here today to talk about something that's very important to me. And something that I really want you to think about as I'm sharing my story with you is that right now in the United States, around 54% of all people living with HIV are 50 and older. So next slide, please. So then the second component of your story structure is what we call connection. It's where you really move beyond the facts or the context, and you really begin to humanize the story. You're building empathy and trust, and you're really helping the audience see themselves in your experience. And it's, this is an important moment where the story starts to resonate emotionally with the folks that you're talking with. And so for here, and I'll just, use myself as an example again, you could start off by saying, I'm a proud member of the HIV community. I am a person who's personally affected by HIV, which means that, I have a family member or a friend who's aging with HIV. And I have been a proud supporter and ally of the HIV community here in Minneapolis, Minnesota. I'm not living with HIV myself, but I believe everyone should have access to services to have a good quality of life. And so when I was thinking today about what I wanted to say to you, I thought about one of my friends who's living with HIV in the state of Minnesota, and that they're on Medicaid. And this is how their healthcare is paid for. And because they have Medicaid, they're able to get their HIV medications from their pharmacy that helps them stay alive, and it helps them have a good quality of life. It also helps pay for the transportation that they need, because as they've gotten older, they haven't been able to take public transportation. So this pays for some medical transportation to make sure they get to see their medical provider. And I just wanted to share a little bit about my friend, and why Medicaid's really important to keeping them healthy and alive. Next slide, please. So the next component here that we're going to look at is really what we call background, and it's the story behind the problem or the situation. And so the background might be where you explain how the situation got to this point. So it's kind of like peeling back the curtain, what led to this change, what decisions or people or conditions shaped it. So this is just kind of part of the sequencing of your story that helps your audience kind of feel even more emotionally engaged before being taken into even more complexities of the story. So for example, here, in my state of Minnesota and at the federal level, people are concerned about HIV funding cuts. So I'm switching the topic a little bit here. I'm going to give you a different example. So if there's HIV funding cuts at the federal level and that money, is cut off that would normally trickle down to the state of Minnesota where I live, that lack of funding causes lack of services that leaves people aging with HIV, like my friend, vulnerable to not receiving the care they need. And then I could go on and maybe share more of a story, where if, a case management program that my friend accessed that helped them like navigate the services that they need kind of went away, what would that look like for their life? Or what could the fear of what could happen if that service go away look like? So that would be another piece where you could share a little bit more about the background of like how this could end up impacting yourself or a friend. Next slide, please. So now we're going to look at what we call values. And this is really where, you're trying to connect with your audience around shared values. And this is kind of a really important piece because while sometimes you're talking with elected officials or maybe people in government and you think you're coming from opposing positions, maybe there's always some kind of value that you might be able to find that you share that could resonate with each other and you could connect with. And so here's an example of a value. So I would say something like, I was raised to treat all people the way I want to be treated. And so it hurts me to see people aging with HIV in Minnesota facing the risk of losing essential services due to funding cuts. I really believe that healthcare is a right, and no one should have to fight for the care they need to live a full and healthy life. And so this is a part where, I could just speak openly and honestly about this value of that I think healthcare is a right, and I think people should be treated fairly. I want to be treated fairly. I'm sure you want to be treated fairly. And that this is a shared value and kind of grounds why I'm so passionate about wanting to protect HIV services for people aging with HIV. Next slide, please. And so finally, at the very end, this is kind of what we're kind of working for by telling our story is so that we can have an ask. And so your ask really helps define the purpose of your meeting or your communication. And it really kind of in a nutshell tells the person that you're meeting with, why you're there, the outcome that you're really seeking, and how they can play a role. So in this situation, I would say, thank you so much for listening to my story today about my friend. And my ask for you today is that you take the time to listen to stories from people aging with HIV, even past today, and listen to allies, across the state that you live and, represent, who really support the dignity and respect for people aging with HIV. And I hope that those stories will motivate you to take action to fight against HIV funding cuts, to protect Medicaid, to say no to Medicaid cuts. And also, anytime you have the opportunity to speak to the press or at public events, that you'll speak out in support for people aging with HIV. Next slide, please. So, I gave you a couple examples of things that like are on the top of my head. One thing that's really at the top of my head right now is Medicaid. So, there's a lot of potential priorities you can speak on. You could talk about, opposing efforts to cut Medicaid. You could talk about Ryan White program, which Ronald spoke about, that, we still need full funding for these health and social service initiatives. Um, you could even break it down in Ryan White, that we need full funding for workforce development programs such as the AIDS Education and Training Center, which, is funded under Ryan White to train healthcare providers, full funding for dental programs. As people get older, they have more and more dental problems. So that would be really important to talk about. In terms of HOPWA, housing opportunities for people with AIDS, you could talk about the need for robust funding for HOPWA programs to meet the housing needs of people living with HIV in the United States. We know that housing is healthcare, that when folks are housed, they do better. Next slide, please. And then there's some additional policy issues that you could talk about. So the Centers for Disease Control and Prevention has the Division of HIV Prevention, which really leads on all of our HIV prevention efforts in the country. They are facing funding cuts. Staff have been let go. And so you could talk about, please make sure that the Division of HIV Prevention doesn't go away. We've made strides in HIV prevention, and it would be devastating for that to go away. You could talk about the National Institutes of Health. There's been millions upon millions of dollars of cuts to HIV research grants, including research grants for HIV and aging. You could talk about, the ask could be for the elected official to fight against those cuts at the National Institutes of Health. And then also the Administration for Community Living, which is the federal agency that focuses on aging and disability, that is going away. And we're very concerned about if it's dissolved into other offices within Health and Human Services, what will that look like? Will it really still be able to focus on work around HIV and aging, which it's done for the last several years. So here's just, a nice list of different policy issues that you can focus on to tie your story in. Pick what resonates with you, what affects your life or the lives of your family, friends, or clients if you're a social service provider. Next slide, please. So now I'm going to turn it back over to Aaron for some final thoughts.
All right. Sorry, the video is taking some time to turn on. Next slide. All right. So, as Terry alluded to, convey your message. It's not just telling your story, but you want to use it to forward an important and unique message. So it might be for you the struggles and challenges around aging with HIV, the power and value of acceptance or pain of exclusion, or really anything else. We're not here to tell you what it is. And I think that gets back to the whole idea here is that you want this to be authentic and come from your heart and something that you personally know, whether that's your own experience and that of a friend or family member. But if it's personal, you can share that story in a personal way. And I think people can see that, and you can just watch a TV show where you see a politician interview or answer a question in an honest way, in an authentic way, and how that sounds compared to someone who's just giving, or just speaking talking points and beating around the bush, and people can tell the difference. So I think you want to, be authentic but also be strategic and share it in a way that's conveying your message. All right, next slide. Tips. Don't go on autopilot when telling your story. Stay aware of how you're feeling and how people respond. So I think, again, like I said, people really notice if you're paying attention, if you're being authentic, or if you're distracted. I mean, I'm guilty of this myself. Imagine you're in a meeting and you're multitasking, you're looking on another screen and you're trying to talk, but people can tell you're distracted or you're not really there in the moment. So be in the moment. Keep the details concise. Know what to leave in and what to leave out. Let your emotions show when telling your story. Don't be shy about this. This openness will help others relate to your message. Stay committed to the truth. Don't exaggerate or change your story because you think it might be more convincing. I mean, people, again, will see through that. Just be real. And if the staffer or legislator asks a question you don't know the answer, don't try to fake it. Instead, promise to follow up with accurate information and resources. And I think, again, I think they'll appreciate that more than, just kind of like going on a long tangent where you don't even answer the question. If you just don't know it, just say it. That's okay. All right, next slide. Stay in touch. Here's all of our contact information. I think I'm turning it back to Cam. Let's see what's on the next slide. All right.
Yeah, thanks, Aaron. So I'm happy to hop on. So as all of our presenters highlighted, there's a lot of great opportunities um, to share your story, to get involved. A way to stay plugged in to those opportunities would be to join Sage's Action Squad, which you can do by scanning the QR code that's on your screen. I will also drop a link in the chat that you can sign up if you're on a computer. But if you sign up for the Action Squad, you're totally kept in the loop on everything that Sage is working on. That's where we send our um, most urgent action alerts, which could be, calling your members of Congress or submitting a public comment during a public comment period. Sometimes we're looking for storytellers. So, any opportunity to engage in this type of work will come through the Action Squad. So you definitely want to make sure you're signed up for that. And Terry, I'll pass it back to you.
Great. I think our last slide just goes on to our questions, which we can take a look at in the Q&A. So one person asked, will we receive a copy of the slides? And everyone will receive a follow-up email with a PDF of the slides and the recording. So don't worry about that. So thanks for asking that question. I know there was a couple of people who mentioned they had to hop off for another engagement. I see that one of my friends asked a question because I mentioned the AIDS education training centers were just really important part of how we train healthcare providers across the United States. And I would say that the AIDS education training centers have been impacted by all the things that are happening at the federal level. They're definitely something that is very concerning that their funding is going to be cut or eliminated altogether. As a person who was previously over an AIDS education training center, I can say that I've always said that they've been criminally underfunded for years. So it's going to be very concerning to watch if they get completely cut or if there's an even more drastic cut to their funding. So that's always something that folks can advocate for. So I want to invite Aaron and Ronald to come on camera because I think there's some other questions here that I think anyone can jump in on. So one person asked the question, I was wondering how an ally to go about sharing stories or anecdotes if they relate to a friend or a colleague or a family member to ensure you have consent and aren't inappropriately sharing aspects of their experience. Are there certain points of someone's story to generally avoid when sharing it? So I'll
I
open up
mean,
that.
yeah, I think there's plenty of ways to do that that are very impactful where you don't have to share almost any personal information. So I'll give you one example that's very short and I think impactful. And I'm going to contrast this with statistics. So we talk a lot about social isolation, and I'll rattle off, some of the LGBT stuff off the top of my head, even though this is an HIV seminar. But, HIV or LGBT older people are twice as likely to be single, 4 times less likely to have kids, blah, 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 blah. I could go on all day with statistics. Instead of that, or maybe in addition to that, one thing I bring up at meetings is a story that one of my coworkers, former coworkers, shared with me when she was doing an intake at our senior center. And someone came in and she asked him, "Who's your emergency point of contact?" And he asked my colleague Catherine if he could list her because he had no one else in his life to list. So to me, that has more of a gut punch than all the statistics about social isolation, because here's this LGBT identified older person, and he had no one in his life that he could list as his emergency point of contact. I think we could all relate to that. We don't know his name. I don't know I've never known his name. I don't know where he lives, presumably in New York City somewhere. There's millions of people there. Who knows who he is? But it's a very quick and impactful story that says a lot, as opposed to just rattling off statistics. So I think it's an example of a type of story that you can tell where you don't have to name anyone, you don't have to get specific, but it can still be impactful. And Ron,
Yeah.
you might have other thoughts too, or Terry, or
Yeah,
Cam.
Ronald, I would love to hear, you talk about, particularly on this topic around HIV and aging. Do you think there's certain points of someone's story to generally avoid when sharing it? So if it's an ally sharing the story of somebody they know, what would you advise? Like maybe some points to avoid or to make more anonymous?
No, I think that question is very good, and it often comes up, for example, in AIDS Watch meetings, where you're speaking. And I think it's appropriate to use your experience within, which includes your having friends and people living with HIV, and to distill some of the issues that they have and they experience, and to represent that. You don't obviously don't should not, must not use their name or any personal identification, but it's appropriate to say that, I have a friend who is older adult living with HIV, and the issues they are experiencing loneliness, and it shows the need for programs, social supports programs for older adults, and basing that need on someone and sharing their reality that is appropriate. Again, obviously, you're not identifying who they are, but that sharing that reality, even if it's not your own, is very, very appropriate. Everyone cannot be in the room. So in many cases, you are representing and standing in for those who cannot be in the room. So I think it is appropriate to be able to use a story, even if it is not your own story, but obviously, again, respecting confidentiality at all times.
Yeah. Thanks, Ronald. And you may have noticed that when I was talking during the section about the different components of the story, I shared a story of a quote friend in Minnesota that's on Medicaid. So there's thousands of people living with HIV in Minnesota. And so just saying that and kind of telling a little bit about their fear of Medicaid going away and impacting their ability to get their HIV meds or seeing their medical provider, you would never in a million years know who I was talking about. So I think there is some ways, and like Ronald said, sometimes, a person with lived experience might not be able to be in that meeting, and you may be the person as a social service provider or a healthcare provider or an advocate in the community, be the only one who can kind of share those like examples of why what you're asking for is so important. So we have another question. Were the initial demographics USA or world? So all the data that Ronald was sharing at the beginning of the event was United States based. Um, so one person asked, so my elected officials are on board with HIV and Medicaid. And I'm assuming that means not cutting. And so they're asking, what can I do in addition to being on the action squad? So are there other opportunities for people to, be more involved around, stopping the Medicaid cuts, particularly around HIV? And so, Cam, you may even want to unmute yourself and come on. And Aaron and Ronald, feel free to jump in. I just know Cam has been doing a lot of work around Medicaid cuts.
Yeah. As well, Terry, were you what would be helpful in this time given the behemoth issue that
Yeah.
Medicaid?
I think any updates you can share on ways to get involved or, if there's petitions or other sign-ons, anything that's coming down would be probably great for folks to hear about.
Yeah, absolutely. So a very quick overview and update because this has been such a long process. There is a bill, you may have heard of it. It's being referred to as the quote, big beautiful bill, which, many folks might disagree with that. that nomenclature. But essentially what the bill entails is drastic cuts to Medicaid, including work requirements. That bill did pass through the House, but still has a long way to go through the Senate, and then based on the amendments in the Senate, back through the House. So this is now, if you haven't been tuned in, if you're not involved or engaged with it, now is the time to do so. Again, I would refer folks to that Action Squad link. Because in the coming days and weeks, roughly, we're working on getting an action alert together to encourage folks to call their members of Congress, specifically their senators at this point, and oppose this bill. Just because of, as Terry outlined, the detrimental effects that it would have for older people living with HIV who are Medicaid beneficiaries. For those who might be saying, "Oh, I live in a blue state. Oh, my senators are supportive of Medicaid," I would say call anyways. It always helps to reinforce the issue, and also sign up for the Action Squad anyways. Just the other week we had there was a campaign through SEIU, which is one of the large service workers labor unions, and they were encouraging folks to call constituents in swing districts, right? So there are other ways to get involved, whether it's calling your representative or calling your friends and neighbors or folks in other districts to ensure that they know what's on the line and they're contacting their representative or their senator who might, be uneasy about Medicaid cuts. Yeah, in the meantime, I can also share in the chat, we put together a resource with our partners at Justice on Aging about the implications of Medicaid cuts for LGBTQ plus older adults, which, there's a lot of crossover in those communities. So I'm happy to drop that in the chat as well.
Great. And Cam, I just sent you a message. If you can, like, for some reason, I can't put stuff in the chat. If you can put the Save HIV Funding campaign email in there as well. So every Tuesday, the Save HIV Funding campaign meetings happen, and folks are very involved around stopping the Medicaid cuts. One thing that I just realized that we just did this past 2 weeks to spread the word about stopping Medicaid cuts and how it impacts people aging with HIV is I wrote a letter to the editor for the Star Tribune, which is the local Minneapolis paper, and I talked about why we have to say no to Medicaid cuts and how that would impact people living with HIV, and in particular, how it would impact people aging with HIV. So that's another way to spread the word about, why Medicaid cuts are bad. A letter to the editor can also be a call to action to whoever's reading that letter that you wrote to encourage them to contact their elected official. And one thing that I would say is, if you've already called, then try to recruit 5 friends or family members to get them to also call their elected officials to say no to Medicaid cuts. We do have one question that, Ronald, I think this might be a good question for you to answer. There's a person who asked a question. Are there repercussions on, quote, coming out as living with HIV when you're like actually talking to an elected official? So, saying, "Hi, my name's Ronald. I'm a person living with HIV." So they're concerned about there could be any repercussions of actually coming out, saying that to an elected official. And if you think that there might be some repercussions, they want to know, how do you think you could limit the negative effects from officials and people in their community?
I really want to thank the person for asking that question, because I think that is always a concern. In terms of repercussions, the ones that, first off, they say that there should not be any repercussions, but I guess it's always a matter of what is comfortable for you. And if you think or fear that there might be some repercussions, you should, just be more measured. But there we need the importance of people coming out and including coming, saying that you're an older person living with HIV or you're living with HIV is very, very important because they members of Congress and particularly the staff. And as Aaron mentioned, you're more often than not talking to staff. And many of these staff members are in their 20s and may not have had the experience of people with HIV. So they need to be able to see what HIV looks like and the reality of it. And it is not, unfortunately, uncommon for congressional officers to say, oh, well, we don't have HIV in my district. Well, yes, they invariably do. And if you are a person living with HIV, it's important for them and are a constituent. And again, as Aaron pointed out, the importance of being a constituent. It's really very important to see that. And I know any form of coming out, and particularly in the political environment that we are facing, is fraught. And I want to acknowledge that. But there should not be repercussions. And it is necessary for those of us who are experiencing HIV, are experiencing aging. We need to have the courage to say that. And you can, in terms of limiting it, you should do risk assessment. I mean, if you're in a district with just a hardcore conservative and who follows the current party line in the majority party that is in Congress, you may want to hold back. But for the most part, I think you should have the courage, you should have the freedom to tell your reality, to tell your story. And we need that. It's very important. But again, I fully appreciate that it's an individual's decision as to how much information they want to share about themselves.
Yeah. Thanks, Ronald. And I think, sometimes you may walk in and have an office and not expect, a negative experience with somebody that you're talking with. I think it's important to let other people in the community know because that's valuable information. So that people can come up with strategy going forward if there's future meetings so that that doesn't happen again. So, you know, stigma, unfortunately, is still alive and well. And there's some folks who have never been educated about HIV. They've never been educated about the lives of folks who are living with HIV and affected by HIV in our community. And sometimes it may feel like you're talking to someone who might be kind of stuck in 1983 or 1984. Um, but, like Ronald said, doing a risk assessment, we don't want people to feel unsafe. And so, sometimes if it feels unsafe, this might be where an opportunity for somebody else to tell your story for you. Um, so I'm looking at the questions, and I think that we have covered everything. So unless any other last minute questions pop up, Cam, I think we're ready to close out for this webinar.
Fantastic. Well, I just want to say thank you all for being here, for spending Wednesday afternoon with us. Um, as some folks mentioned, and we tried to answer all the questions in the chat. You will receive a follow-up email with the recording of this webinar, the slides, as well as the recording of last week's session, which focused on media training. So if you weren't able to make that one, don't worry, you'll receive a recording to that as well. As I've been trying to hammer home, make sure to join the Action Squad. That's, again, just the best way to stay in touch and stay up to date with all that we're working on and the ways you can engage. But yeah, I just thank you so much for being here, and we appreciate your presence, your engagement, and above all else, your advocacy. So thank you very much, and we'll see you at the next one.
Thanks, everybody.